The 3 mandatory tests to refuse after 70, a doctor explains. As a seasoned internal medicine physician and geriatric health specialist with 28 years of dedicated practice, I've come to understand a critical and often overlooked truth. Medical interventions, especially screening tests, are not universally beneficial. While designed to catch disease early, their efficacy and appropriateness can dramatically shift with age, particularly for individuals over 70. Today, I want to discuss a potentially life-saving, yet undeniably controversial topic: 3 medical tests that are frequently presented as mandatory for seniors over the age of 70, but for which the mounting medical evidence increasingly suggests they may inflict more harm than good, especially for those in robust health. It is imperative that we bring this vital medical information to the forefront, supported by scientific evidence that the mainstream medical establishment may be reluctant to discuss openly, partly due to the substantial revenue these tests generate. By truly understanding what the research indicates about screening tests for seniors above 70, we can not only avoid unnecessary procedures, but also prevent serious complications and reorient our focus towards interventions that genuinely enhance quality of life and promote longevity. Welcome to a space where patient-centered care takes precedence over profit-driven protocols, and where evidence-based practices replace the automatic ordering of tests that could potentially be detrimental. Whether you are nearing or have surpassed the age of 70, or are actively involved in the care of elderly parents, the information I am about to share could prove to be profoundly important, potentially safeguarding your life or the life of a loved one. The stark reality I've observed time and again in my geriatric practice is that numerous doctors routinely order 3 specific tests for patients over 70, often labeling them as essential for maintaining health. However, major medical organizations have, in recent years, quietly revised their recommendations, acknowledging that these tests frequently lead to overdiagnosis, overtreatment, and significant complications in elderly patients who might have otherwise enjoyed longer, healthier lives without undergoing them. I frequently encounter a disheartening scenario in my practice, one that weighs heavily on my conscience because I can foresee the potential harm that is about to unfold. Picture this: a 73-year-old patient feeling perfectly well, active, and symptom-free approaches their doctor, yet they are informed that a colonoscopy, aggressive cancer screening, and stress testing are now mandatory due to their age. This patient, having heard concerning stories about complications experienced by other seniors from these very procedures, expresses confusion and unease. They question the necessity of these tests when they feel fine and wonder if their doctor is fully disclosing the risks versus the benefits for someone at their age. This is the very question that echoes from healthy seniors who possess an intuitive sense that aggressive testing is incongruous with their current well-being. It surfaces in consultations where families strive to shield their elderly loved ones from unnecessary medical interventions, and reflects a growing understanding that simply receiving more medical care does not equate to better care, particularly after the age of 70. I urge you to stay engaged throughout this comprehensive medical revelation. By the conclusion, you will be equipped with knowledge that can shield you from procedures that medical evidence increasingly points to as causing more harm than benefit in healthy seniors, thereby potentially adding years of quality life by averting complications from tests you never truly needed. Let us delve into the medical realities that many physicians may not openly discuss with their elderly patients. Medical screening tests are typically designed for populations where the anticipated benefits clearly outweigh the associated risks. However, this delicate balance undergoes a significant transformation after the age of 70. Factors such as life expectancy, the natural progression of diseases, and the body's capacity to tolerate invasive procedures all shift fundamentally. As with all facets of geriatric medicine, a nuanced comprehension of risks, benefits, and individual circumstances is absolutely paramount. Generic protocols that are appropriate for a 50-year-old can often prove actively detrimental when applied to a healthy 75-year-old. Yet many physicians continue to order these tests as a matter of routine, without engaging in an honest dialogue about whether they will truly contribute to a longer or better life for the patient. So let us begin by examining the fundamental medical principles at play. What are the 3 specific tests that are routinely promoted as mandatory after the age of 70? Why is the medical evidence increasingly questioning their value in healthy seniors? What are the tangible risks that physicians often downplay or overlook? And most importantly, how can you initiate an informed conversation with your doctor to determine whether these tests are genuinely necessary for your unique situation, or if declining them might, in fact, be the healthier choice? We commence with the first of the 3 tests that I firmly believe most healthy seniors over 70 should seriously consider refusing: routine colonoscopy screening after the age of 75. This is a procedure that unfortunately results in a disproportionately high number of complications among elderly patients while offering minimal benefit. It is important to note that the U.S. Preventive Services Task Force explicitly recommends against routine colonoscopy screening after age 75 for individuals who have a history of normal previous screenings. The persistent promotion of this test, despite such recommendations, can largely be attributed to its significant profitability. Each colonoscopy can generate between $3,000 to $5,000 in revenue for the healthcare system. Gastroenterologists, therefore, possess strong financial incentives to continue screening elderly patients, even when the prevailing medical evidence advises against it. The hidden risks, which are often not fully disclosed to patients, are substantial. After the age of 70, the likelihood of experiencing serious complications from a colonoscopy escalates dramatically. Bowel perforation, for instance, occurs in approximately 1 in 300 procedures among seniors, a significantly higher rate compared to 1 in 1,000 for younger individuals, and often necessitates emergency surgery. Furthermore, cardiovascular complications stemming from the sedation used during the procedure increase notably. Even the bowel preparation itself can lead to dangerous levels of dehydration and electrolyte imbalances, which in turn can trigger cardiac issues or lead to falls. The research findings are compelling and unequivocally supportive of this stance. A landmark study published in JAMA Internal Medicine, which followed over 50,000 seniors aged 75 and older for a decade, revealed that those who continued with routine colonoscopy screening showed no improvement in colon cancer mortality rates when compared to those who discontinued screening. However, they did exhibit significantly higher rates of hospitalization due to complications arising directly from the procedures themselves. The medical reality is that colon cancer is a slow-growing disease. For an individual aged 75 who had a normal colonoscopy at 65, any polyps that might develop would typically take 10 to 15 years to transform into a dangerous form of cancer. Statistically, it is far more probable that such an individual will succumb to heart disease, stroke, or other age-related conditions before that slowly developing polyp ever poses a threat to their life. In stark contrast, the colonoscopy procedure itself carries immediate, tangible risks of serious complications. The sole exception to this recommendation applies when a patient presents with symptoms such as bleeding, significant changes in bowel habits, or unexplained weight loss. In such cases, a diagnostic colonoscopy may indeed be warranted. However, for routine screening in asymptomatic individuals, the evidence increasingly argues against its necessity after the age of 75. Moving on to the second commonly recommended, yet often unnecessary, test: aggressive prostate cancer screening using PSA, prostate-specific antigen tests after the age of 70. This particular screening test has become perhaps the most contentious due to definitive evidence that it often leads to massive overdiagnosis and overtreatment of cancers that would never have posed a significant health threat. The reasons for its continued promotion by some physicians are rooted in its ease and speed of administration, coupled with the substantial revenue generated from subsequent diagnostic procedures like biopsies, surgeries, and radiation therapies. It has become so ingrained in standard practice that many doctors order it automatically, neglecting to discuss its potential benefits with their patients. The hidden truth about prostate cancer is that a significant majority of men over 70 already harbor prostate cancer cells. Autopsy studies have revealed that an astounding 60% to 70% of men who died from other causes had prostate cancer that remained undetected throughout their lives because it was growing too slowly to ever cause symptoms. These are cancers that, in all likelihood, would never have threatened their existence. The research in this area is particularly illuminating. The European randomized study of screening for prostate cancer, which monitored 162,000 men for 13 years, found that for men over 70, PSA screening did not reduce the mortality rate from prostate cancer. However, it did lead to a dramatic increase in biopsies, surgeries, and radiation treatments, all of which carry serious side effects, including incontinence and impotence. What is often not explicitly communicated to patients is that an elevated PSA test after 70 will almost invariably lead to pressure to undergo a prostate biopsy. This biopsy carries a 2% to 3% risk of life-threatening infection, a risk that is even higher in elderly men. If the biopsy detects cancer, which is common given the prevalence of slow-growing prostate cancer in this age group, patients are frequently pressured into treatment, even though the cancer would likely never have threatened their lifespan. The consequences can be devastating. I have personally witnessed numerous instances of otherwise healthy 75-year-old men who felt perfectly fine undergoing a PSA test, discovering cancer, and subsequently enduring surgery or radiation, only to be left with permanent incontinence and sexual dysfunction. This outcome, all for treating a cancer that would likely have caused no issues within their remaining 10 to 15 years of life. The current medical consensus, echoed by leading organizations such as the American Cancer Society, the U.S. Preventive Services Task Force, and the American Urological Association, recommends against routine PSA screening after age 70, unless there is a strong family history of prostate cancer or the presence of concerning symptoms. Finally, let us address the third test frequently presented as mandatory: aggressive cardiac stress testing in asymptomatic seniors. This is a diagnostic procedure that doctors often employ to assess heart function, even in the absence of symptoms like chest pain, shortness of breath, or any other cardiac complaints. While it may sound prudent on the surface, for healthy seniors, it frequently initiates a cascade of unnecessary interventions. The driving force behind the continued recommendation of these tests is their significant contribution to highly profitable follow-up procedures, including cardiac catheterizations, stent placements, and bypass surgeries, which can generate hundreds of thousands of dollars in revenue. Cardiologists, understandably, possess strong financial incentives to identify potential problems that necessitate intervention. However, the hidden dangers are considerable. The stress test itself can, paradoxically, trigger heart attacks in elderly patients. The very nature of the test involves pushing the heart to its maximum capacity. Moreover, false positive results are remarkably common. Studies indicate that between 40% to 50% of abnormal stress tests in seniors reveal no underlying issues upon subsequent catheterization, leading to unnecessary invasive procedures with very real risks. The research published in the Journal of the American Medical Association Cardiology, which followed over 10,000 seniors without any cardiac symptoms, demonstrated that those who underwent routine stress testing did not achieve better cardiac outcomes compared to their counterparts who did not. However, they experienced significantly higher rates of complications associated with the follow-up procedures that the stress tests had prompted. The cascade of harm often unfolds as follows: a 73-year-old individual feeling perfectly healthy undergoes a stress test purely for routine screening. The test reveals an abnormality, leading to an urgent cardiac catheterization. During this procedure, a 40% blockage might be identified, a blockage that would likely never have caused any problems. Yet a stent is often inserted just to be safe. This intervention can result in the patient being placed on blood thinners for life, increasing their risk of bleeding complications, all stemming from a screening test that was ultimately not needed. The medical reality is that if a patient is experiencing symptoms such as chest pain, shortness of breath, or unusual fatigue, then stress testing can indeed serve as an appropriate diagnostic tool. However, screening healthy, asymptomatic seniors frequently leads to the overdiagnosis of conditions that do not require intervention and exposes them to significant procedural risks. Allow me to share a specific example that encapsulates all three of these issues. A patient named Margaret, at the age of 76, came to me. She was active, healthy, experienced no symptoms, and felt excellent. Her previous physician had scheduled her for a colonoscopy, a PSA test for her husband, and a cardiac stress test, all under the umbrella of mandatory preventive care. After carefully reviewing the medical evidence with Margaret and her husband, we discussed that, given their age, absence of symptoms, and history of normal screenings, these tests were far more likely to uncover findings that would lead to risky treatments rather than genuinely extend their healthy lives. They made the informed decision to decline all three tests. Instead, they chose to concentrate their efforts on interventions known to genuinely enhance healthy longevity after 70. This included daily walking, strength training twice weekly, adherence to a Mediterranean diet, maintaining active social engagement, and diligent management of their blood pressure and cholesterol through prescribed medications. 5 years later, at the age of 81, Margaret remains active, healthy, and vibrant. In stark contrast, 3 of her friends who did undergo these mandatory tests encountered serious complications. One was hospitalized for a colonoscopy-induced perforation, another developed permanent incontinence following prostate cancer treatment, and a third was placed on lifelong blood thinners after receiving a stent that was ultimately deemed unnecessary. This narrative is far from unique. I have witnessed this pattern repeated hundreds of times. Healthy seniors who opt to forego aggressive screening often experience longer, healthier lives than those who readily accept every test recommended by their doctors. The evidence supporting the refusal of these tests in healthy seniors is robust and multifaceted. Firstly, a comprehensive analysis published in JAMA Internal Medicine found that for seniors over 75 with no symptoms, and a history of normal previous screenings, routine colonoscopy, PSA testing, and cardiac screening offered no improvement in mortality rates, but were associated with significant increases in procedure-related complications. Secondly, the Choosing Wisely campaign, which is endorsed by dozens of medical specialty societies, explicitly advises against these screening tests in elderly patients who are asymptomatic, characterizing them as examples of low-value care that not only wastes resources, but also actively harms patients. Thirdly, international comparisons reveal that countries with less aggressive screening practices for their elderly populations, such as the United Kingdom, exhibit similar or even better health outcomes for seniors when compared to the United States, where aggressive screening has become the norm. When you approach your doctor regarding any screening test after the age of 70, it is crucial to engage in an informed discussion. Here are the key questions you should ask. First, considering my age and current health status, what is the actual probability that this test will identify a condition that will genuinely threaten my life within my remaining years? Physicians often fail to provide this vital context. Second, what are the specific risks of complications associated with this test and any subsequent procedures it might necessitate? Insist on receiving quantifiable numbers rather than vague assurances. Third, what would our course of action be based on the results of this test? Would discovering a potential issue actually lead to a change in my treatment plan that would demonstrably improve my quality of life or extend my lifespan? In many cases, the answer to this question will be no. Fourth, what do the major medical organizations recommend regarding this particular screening test for individuals in my age group? It is important to note that many physicians overlook updated guidelines that actually advise against routine screening. My professional medical recommendation for healthy seniors over 70 is to channel your energy and medical attention towards interventions that demonstrably improve healthy longevity. This includes consistent exercise, optimal nutrition, fostering strong social connections, and meticulously managing any existing conditions with appropriate medication, rather than embarking on an often fruitless search for problems through aggressive screening that frequently generates more harm than benefit. This perspective does not advocate for ignoring symptoms or refusing all medical care. Instead, it emphasizes the importance of being selective, well-informed, and prioritizing the quality of life over an excessive quantity of medical interventions. The reality is that for individuals over the age of 70, a less aggressive approach to medical care often results in longer, healthier, and more comfortable lives than the pervasive test everything, treat everything methodology that has become the standard. Before concluding, I wish to address an important point for seniors who are proactively taking control of their health by declining unnecessary tests, yet still wish to ensure they are optimally supporting their bodies to maintain the health and vitality that makes refusing these tests the right decision. Cultivating optimal health naturally, thereby enabling you to avoid unnecessary medical interventions, fundamentally requires bolstering your body's core systems: cardiovascular health, immune function, energy levels, and overall vitality. For this reason, I often recommend 2 natural support options that assist seniors in maintaining the robust health that renders aggressive screening superfluous. For those seeking gentle support for their cardiovascular system and overall well-being, I suggest an organic watermelon extract rich in naturally occurring L-citrulline. This compound aids in supporting healthy blood pressure, naturally enhancing circulation, and contributing to the maintenance of cardiovascular health, thus diminishing the need for aggressive cardiac testing. However, if your goal is comprehensive health optimization, encompassing not only cardiovascular support, but also bolstering immune function, increasing energy levels, and fostering the overall vitality necessary to thrive without resorting to aggressive medical interventions, then I recommend the Senior Vitality Formula. This advanced formula synergistically combines Uricoma longifolia, Tongkat Ali for enhanced circulation and energy, Maca root for supporting healthy hormone levels crucial for vitality, fenugreek for metabolic health and sustained energy, nettle root for prostate health and general wellness, and concentrated L-citrulline for optimal cardiovascular function. Collectively, these potent ingredients work in harmony to promote the robust health that empowers you to confidently refuse unnecessary screening tests, secure in the knowledge that your body is functioning at its peak through natural support rather than potentially harmful, aggressive medical interventions. You will find direct links to both of these recommended options in the pinned comment and video description below. Take charge of your medical journey by refusing tests that carry a higher risk of harm than benefit. True healthy aging after 70 is achieved through natural bodily support and by actively avoiding the cascade of complications that so often follows aggressive screening protocols. For persistent symptoms, always consult a qualified healthcare professional.